Hi, Dr. Mike here from Anderson Family Chiropractic. Now today I want to talk to you about something that parents deal with on a routine basis, and that's ear infections. And I've been seeing a lot of ear infections here in the office here lately. And ear infections occur because there's not proper drainage occurring in the tubes in the ears. And so what happens typically is, your child's ears start hurting, you take them to the medical doctor or your pediatrician, they look in the ears, say, yep, they've got an ear infection, and then they prescribe an antibiotic. Antibiotics are geared towards killing bacteria. What we know about most ear infections is that they're actually caused by a virus. So antibiotics will do nothing against the virus. You give a kid who's got a viral ear infection an antibiotic, and all it's going to do is going to destroy their digestive beneficial bacteria, and that can cause problems later on down the line. So now nothing's happening, and the kid, what will typically happen is they'll continue to get ear infections, get repeated ones. So now more doses of antibiotics that really aren't doing anything but destroying that bacteria. And then if that keeps happening, they keep getting ear infections, now you may be sent to a specialist and they'll look in the ears and say, you know what, we need to put tubes in their ears. So now that's a surgery. So there can be complications from surgeries, complications from anesthesias. And there's no guarantee that those tubes are even going to work. Sometimes the tubes fall out or they don't even help with the drainage. Now this impaired drainage can occur for different reasons. You see, in kids, the tubes in their ears are a little more horizontal than in adults. So gravity isn't able to help with that drainage as much. Now, the way that drainage does occur is through proper range of motion in your head and neck. Because when they move their head and neck from side to side all around, now that's going to move that fluid around and help with the drainage. But if there's misalignments in their upper neck, then they don't have that proper range of motion, and now the fluid doesn't drain, it's going to stay there, and that creates the environment for the virus or sometimes a bacteria to grow. The other thing that can occur is when you have misalignments in your upper neck, all the nerves that control your ear, nose, and throat and your sinuses, all that comes from your upper neck. So if you have misalignments there, now there's going to be irritation on those nerves. And the signals that come from your brain, which control everything in your body, out to your ear, nose, and throat are being interfered with. So now that's all not functioning properly. And that's going to affect the drainage. So what chiropractic can do is chiropractic doesn't actually cure the ear infections. What chiropractic will do is it will restore the proper function of the child's body. So with the adjustment, it's going to correct that misalignment and restore the proper movement. So now that's going to assist in the drainage of the tubes, and it's also going to remove the interference on those nerves. So now the proper signals from the brain are getting out to the ear, nose, throat, sinuses, and everything that's going on in that area. So if you have a child that's been suffering with ear infections, feel free to give me a call, Anderson Family Chiropractic, 616-735-1920. We can get them in the office, take a look at them, do our exam, find out if they do have any interference, impaired function going on, and let you know how we can help restore their function. So thank you for watching this video. Hope it was informative. Take care and have a great day.